we will discuss disorders of the thyroid gland. I am Dr. Iman Khalifa, Lecturer of Pediatrics, Faculty of Medicine, Helwan University. So, our objectives today are to revise our knowledge of thyroid hormone physiology, understand the reason for neonatal thyroid screening, interpret thyroid function test, and determine the appropriate approach for newborns with abnormal thyroid screen. Also, to understand the causes and manifestations and treatment of hyperthyroidism and hypothyroidism. So, the thyroid hormone production and secretion are tightly regulated by the hypothalamic pituitary thyroid axis in a classic endocrine feedback loop. Thyrotropin-releasing hormone from the hypothalamus stimulates the secretion of thyroid-stimulating hormone. Thyroid-stimulating hormone stimulates the production of thyroxine and triiodothyronine. T3 is bioactive and derived from conversion of T4 by deiodinases. The free thyroid hormones act on target tissues and provide negative feedback to the hypothalamus and pituitary gland. فأول حاجة بتحصل الأيودايد بيبقى trapped by the thyroid gland بيتحول لأيودين والأيودين بيbind مع tyrosine to form monoiodotyrosine and diiodotyrosine. Two molecules of diiodotyrosine form tetraiodothyronine, and one molecule of monoiodotyrosine and diiodotyrosine form triiodothyronine. يبقى أول حاجة بيحصل trapping وبعدين binding وبعدين coupling. This is to show us the hypothalamus produces thyrotropin-releasing hormone. This stimulates the pituitary to secrete TSH from the anterior pituitary. The TSH stimulates the thyroid gland to produce T4 and T3, which act on peripheral tissues. T4 and T3 have a negative feedback on the pituitary and on the hypothalamus to decrease TRH and TSH. So thyroid disorders are very common. Given the prevalence of thyroid disease, thyroid function tests are the most frequently ordered endocrine tests in the outpatient setting. بيطلبوا كتير قوي في الاوتبيشنت setting. بيجي العيان مثلا بسويلنج in the lower neck فبيطلبوا. بيجي العيان عنده heart disease, tachycardia, sweating, agitation, tremors بيطلبوا. بيجي العيان slow and apathetic وبيحس بالبرودة بيطلبوا thyroid function test. فدايما بنفكر في الثايرويد فانكشن تيست لما بيجي لنا اي عيان بsymptomatology suggesting thyroid disease. So what are the functions of the thyroid hormone? They are responsible for growth and development, brain neurogenesis and myelination. Deficiency in early life is irreversible and may cause brain damage. They are important in the metabolism. They stimulate oxygen consumption. They are important for the cardiovascular system. They stimulate cardiac function. GIT, they stimulate motility. With blood, the synthesis of RBCs. And they help in transformation of carotene to vitamin A. So they are important for all body actions. Thyroid function develops in 3 stages. In the first trimester, the gland descends from the floor of the primitive oral cavity to its definitive position in the anterior lower neck. By the second trimester, the hypothalamic pituitary thyroid axis becomes functional. And in the third trimester, peripheral metabolism of thyroid hormones matures. So our case today is a girl with a neck swelling. Shadia is a 14-year-old girl who is referred to the pediatric outpatient department because she has noticed a swelling in her neck. She has lost 3 kilograms in the last 2 months and is having trouble sleeping. In addition, Shadia's mom says she has been much more anxious and shaky than normal for the past few weeks, and she thinks that Shadia's eyes are bigger than normal. She started her periods 2 years ago. These were regular, but in the last few months, they have become irregular. Shadia's mom has type 2 diabetes, and her aunt has an underactive thyroid. No other diseases run in the family. She is on no medication. يعني الحالة بتاعتنا النهاردة عندها 14 سنة، جاية بتشتكي من ورم في رقبتها، وبتقول إن في آخر شهرين الوزن بتاعها نقص 3 كيلو، وإن هي بتجد صعوبة في النوم، وإن مامتها ملاحظة إن هي الأيام دي إيه anxious وشيكي، يعني دايما كده apprehensive، يعني متضايقة كده شوية، ولاحظت إن عينيها كبروا، بقالها سنتين عندها البيريد وكانت ريجولر وكل حاجة، بس في آخر الكام شهر اللي فاتوا دول بقى إيه irregular، يبقى في menstrual irregularities. في family history عند شادية إن مامتها عندها type 2 diabetes، وإن عندها aunt عمة أو خالة عندها underactive thyroid. يعني في history في الفاميلي of endocrinal problems. By examination, Shadia appears restless، مش قاعدة كده على بعضها، with mild exophthalmos، يعني عينيها باظة لبره. Her hands are sweaty and tremulous، ايديها عرقانة وبتترعش. Her heart rate is 150 beats per minute، عالي شوية. And blood pressure is 134/70 millimeters mercury. Examination of her neck reveals a large, smooth goiter in the midline of the anterior neck. زي ما هو باين في الصورة كده، في swelling في الايه، في الميد لاين في الانتيريور نيك، والبنت عندها exophthalmos، يعني هي بتبرق كده شوية. Her height is 161 centimeters, which is on the 50th centile for her age, and her weight is 41 kilograms, which is on the 9th centile. The doctor ordered the thyroid profile, which showed a serum TSH of less than 0.1, which is less than normal, milliunit per liter, and her serum free thyroxine, free T4, and free T3 were 55 picomole per liter and 27 picomole per liter, which is above norm for the norms. يعني ال TSH واطي والفري T4 وال T3 عاليين، وعمل TSH receptor antibody طلع positive. So what is the most likely diagnosis? Shadia has signs and symptoms that are highly suggestive of thyrotoxicosis. As her photograph demonstrates, she has exophthalmos and a goiter. وبرضو she has lost weight She has menstrual irregularities. She has sweaty hands, and she is tremulous. عندها رعشة, tremors. She is anxious. مش بتعرف تنام كويس. يعني في symptomatology suggestive of thyrotoxicosis. So what is the differential diagnosis of thyrotoxicosis? Graves' disease, Hashimoto thyroiditis, which usually presents with hypothyroidism but can present with hyperthyroidism. Subacute thyroiditis, multinodular thyroid, hyperthyroid goiter, autonomous nodules, TSH-producing pituitary adenoma, syndrome of selective T4 resistance, overdose of thyroxine, medication side effects such as amiodarone and iodine, which are goitrogenic drugs, McEwen-Albright syndrome, which is a disorder that affects the bones, skin, and several endocrine tissues, of which the thyroid is one of them. So what is the definition of goiter? It is an enlargement of the thyroid gland. It is a midline mass that moves with swallowing. موجود في الميدلاين بتاع النك وبيتحرك مع البلع. Thyroid function test should be obtained with all cases of thyroid enlargement. Anti-thyroid antibodies, زي anti-peroxidase antibodies and anti-thyroglobin antibodies may indicate an autoimmune etiology. فنورمالي الثايرويد بيبقى الحجم ده في الانلارجد ثايرويد في الجويتر بيبقى ايه اكبر في الحجم بيكبر. Enlargement of the thyroid gland. So if we have a neck mass which is acquired in the midline and moves with swallowing, we say that this is a goiter. And we ask ourselves by examination, is it hard? Is it solitary? Is it rapidly growing nodule? If yes, then we should do a thyroid scan and an ultrasound, and we may need or may need not to do a fine needle aspiration or biopsy in order to exclude or diagnose benign adenoma or carcinoma. If this is not a hard, solitary, rapidly growing nodule, we should do a free T4 and a TSH and anti-thyroid antibodies, plus or minus thyroid scan and ultrasound. If this patient, if the functions are normal, euthyroid, this is a simple colloid goiter, which is usually due to iodine deficiency, or Pendred syndrome, which is goiter and deafness, or lymphocytic thyroiditis. If the functions show hyperthyroid, then this may be Graves' disease or lymphocytic thyroiditis. If the functions are hypothyroid, then this can be lymphocytic thyroiditis, endemic goiter due to iodine deficiency, goitrogenic drugs, زي الاميودارون, or defect in thyroid hormone synthesis. A radioactive iodine uptake scan with iodine 123. In Graves' disease, the uptake will be high and diffuse. In toxic nodule, the uptake will be focal, known as hot nodule. In toxic multinodular goiter, we will have a heterogeneous uptake. and radioactive iodine uptake in subacute and silent thyroiditis and recent iodine load will be low. So what is Graves' disease? It is the most common cause of thyrotoxicosis in children. It is an organ-specific autoimmune disease whose major manifestations are owing to the circulating autoantibodies that stimulate thyroid-stimulating hormone receptor. في receptor لل TSH. الانتيبودي ده بيجي يبقى attached لي ويستيمولate it leading to thyroid hyperplasia and unregulated thyroid hormone production and secretion. في الحالات دي بنلاقي auto antibodies للthyroid stimulating thyroid stimulating immunoglobulin اللي هو TSI or TSA اللي هو thyroid stimulating antibody. So this is a radioactive uptake of iodine. This is the normal, and this is increased uptake in Graves' disease. Graves' disease is 5 times more common in girls than in boys, with a peak incidence in adolescence. There are personality changes, mood instability, and poor school performance. There is tremor, anxiety, inability to concentrate, and weight loss, which may be insidious. يجي كده بالراحة فالناس confuse it with psychological disorder. والgoiter بيبقى firm homogeneous inconsistency. زي ما قلنا common symptoms يعني اللي بيبقى الناس بتلاحظها أكتر excessive sweating بيعرق كتير, heat intolerance مش بيستحمل الحرارة, increased bowel movements يعني بيخش الحمام كتير, tremors, agitation. مهم جدا rapid heart rate والpalpitation. يعني cardiac manifestation of Graves' disease we have to put it in mind إن ممكن الناس اللي بيبقى عندهم palpitation rapid heart rate إن إحنا نفكر في إيه مثلا ده ممكن يكون thyroid problem. وبرضو irregular heart rhythms, palpitations وheart failure. يعني لازم نفكر في القلب في حالات الثايروتوكسيكوزيس. وبعدين weight loss despite increased appetite ممكن يبقى فيه muscle weakness, irregular menstrual periods زي ما قلنا, insomnia عدم يعني الأرق في النوم زي الحالة اللي كانت زي شادية كده, حالة شادية. common signs بقى ممكن يبقى فيه hyperactivity أو hyperkinesis, ممكن نلاقي sinus tachycardia و atrial arrhythmias و systolic hypertension. الإيدين بتبقى دافية و moist. ممكن العينين تبقى مبرقة كده نتيجة للأكزوثالموس وبيبقى فيه lid lag and stare look. فده جدول من الكتاب بيبين ال clinical manifestations of hyperthyroidism. How can we treat شادية? أو how should شادية be treated? في 3 حاجات اللي هما either anti-thyroid medications to decrease thyroid hormone synthesis أو radioactive iodine to reduce the amount of thyroid tissue or thyroidectomy, partial or total thyroidectomy. فالانتي ثايرويد ميديكيشنز اللي هم الثايونامايدز اللي هم الميثيمازول والبروبايل ثايوريسين. الميثيمازول او الكاربيمازول هو ده اكتر حاجه بنستخدمها. الميثيمازول is the active metabolite of carbimazole. الراديو-اكتيف ايودين ممكن يستخدم برضو. والثايرويدكتومي either ان احنا نشيل الغده كلها او جزء منها. في بقى يعني في cons and pros للثايرويدكتومي، مش موضوعنا دلوقتي، هتاخدوه في الجراحه ان شاء الله. مهم جدا برضو في التريتمنت اوف جريفز ديزيز البيتا بلوكرز زي البروبرانولول او الاندرال. They are useful to control adrenergic symptoms such as palpitations and tremors. Cardioselective beta blockers with higher cardioprotective effects and superior prevention of atrial fibrillation represent an alternative choice, especially in patients with asthma. في حاجة اسمها thyroid storm, which is a rare medical emergency manifesting as decompensation of multiple organs consisting of tachycardia, disorientation, elevated blood pressure, and hyperthermia. نعالج العيانين دول ازاي؟ reducing hyperthermia with a cooling blanket. وندي beta blocker to control التاكيكارديا. وممكن ندي iodine to block the thyroid hormone release after anti-thyroid medication is started. في entity اسمها Congenital Hyperthyroidism. This disorder results from transplacental passage of maternal thyroid stimulating immunoglobulins. الطفل بيبقى irritable وعنده tachycardia, polycythemia, craniosynostosis يعني السكال بتقفل بدري, في advancement of bone age, في poor feeding وفي failure to thrive. This condition may be anticipated if the mother is known to be thyrotoxic. يعني الأم عندها thyrotoxicosis, وإحنا عملنا لها تحليل لقينا elevated thyroid stimulating immunoglobulins during the third trimester of pregnancy. فبنanticipate إن ممكن الطفل اللي جاي بالsymptoms دي يكون سببها transplacental passage of maternal thyroid stimulating immunoglobulins. Spontaneous resolution of neonatal thyrotoxicosis resulting from transplacental passage of TSIs usually occurs by 2 to 3 months of age. في الحالات اللي هي minimally affected ممكن يعني observe without treatment. الحالة الثانية بقى اللي احنا هنتكلم عليها النهاردة شادي, ولد, a 3-week-old baby born following a normal pregnancy, labor and delivery with a birth weight of 3.4 kilograms. الأطفال لما بيتولدوا بياخدوا عينة من كعب الرجل as a neonatal screen. The parents had been contacted by the Ministry of Health and Population when he was 2 weeks old because the neonatal thyroid screening test performed was abnormal. لقوا فيه abnormality في الثايرويد screening test, they contacted the parents. The baby appeared well, but the parents felt he was a little slow to feed. at the clinic الأهل خدوا الطفل وراحوا بيه الإيه العيادة بالتحليل. فالبيدياتريشن لقى إيه the parents are not related مش قرايب and there was no family history of thyroid disorders or goitrogenic ingestion during pregnancy. الأم ما أخدتش إيه أي أدوية ولا في family history لthyroid disorder. There were no abnormal findings when the baby was examined. يعني الدكتور كشف على البيبي ما لقاش فيه أي abnormality، بس هو بس الأهل كانوا بيشتكوا إن هو إيه مش بيرضع كويس. ف investigation showed that in the bone age of the knee was delayed. حاجة اسمها absent distal femoral epiphysis. والسيرم T4 كان واطي والTSH كان عالي above 40 ملي يونت per liter. فهم وزارة الصحة والسكان كلموا الأب علشان الTSH بتاع الطفل ده كان عالي، فراح الطفل للعيادة وعادوا له التحاليل تاني فلقوا برضو إن TSH عالي فعلا وعملوا له free T4 لقوها إيه low. فعلاج طفل زي ده إن هو ياخد التروكسين as soon as possible and regular follow-up. This is a case of hypothyroidism. What is hypothyroidism? It is a condition where there is reduced hormone production of the thyroid gland. احنا اتكلمنا في حالة شادية إن كان عندها hyperthyroidism, increased production of the thyroid hormone. أما شادي فهو عنده إيه reduced production of the thyroid hormone. Hypothyroidism بيتقسم according to the time of onset. The hypothyroidism in infants and young children ممكن يبقى congenital أو acquired. Congenital ده presents early in the neonatal period and early infancy. Acquired hypothyroidism present in childhood after a period of normal growth. يعني according to the time of onset either congenital or acquired. وبيتقسم according to the site of the lesion. يعني الليجن ده في الثايرويد جلاند فده بنسميه primary hypothyroidism، وده ممكن يكون congenital أو acquired. ولو الديفكت في البيتويتري يبقى ده secondary hypothyroidism، وده يبقى due to inadequate stimulation of the thyroid gland by TSH. وممكن يبقى tertiary نتيجة لديفكت في الايه في الهايبوثالاموس. في البرايمري hypothyroidism بنلاقي ان ال TSH high وان ال T3 وال T4 low، بس في السكندري وفي التيرشري بحيث ان الديفكت بيبقى higher in level either in the pituitary أو in the hypothalamus، فبنلاقي low TSH و T3 و T4 و free T3 و free T4. if we do a free T4 and a TSH. If we have a low free T4 و low TSH بنفكر إن ده secondary أو tertiary hypothyroidism. بنعمل TRH stimulation test لو no TSH response ده يبقى secondary hypothyroidism. لو في increased TSH response ده يبقى tertiary hypothyroidism. يعني لو عملنا stimulation ب TRH وحصل increased TSH يبقى العيب مش في الانتيريور pituitary، العيب في الهايبوثالاموس، وده يبقى اسمه ايه؟ tertiary hypothyroidism. لو بقى لقينا في elevated TSH و low free T4 ده يبقى primary hypothyroidism. لو في fall in linear growth, short stature و bone age delayed وبنعمل antibody measurement, thyroid peroxidase is elevated وthyroglobulin is elevated ده يبقى autoimmune thyroiditis. فزي ما قلنا primary hypothyroidism either congenital or acquired. Will congenital causes are more serious علشان بيحصل early in life أثناء ما بيبقى فيه developing brain وmyelination. فلو ما لحقناش الطفل ده بدري ممكن يؤدي إلى permanent mental retardation. فأسباب congenital hypothyroidism إيه؟ ممكن يكون maldevelopment and maldescent. ممكن يبقى فيه agenesis, dysgenesis أو ectopic thyroid. والdysgenesis ده يعني هو the most common cause of congenital hypothyroidism. الectopic thyroid ده احنا زي ما قلنا ان الثايرويد بيديسند من the floor of the mouth to its normal position in the lower neck. فممكن الectopic thyroid ده يكون مثلا lingual thyroid higher up, it did not descend properly into the normal place. ممكن برضو السبب يكون dyshormonogenesis وده بيكون disorder in the intrathyroid metabolism، يعني تكوين الثايرويد نفسه. فممكن يبقى فيه maldevelopment and maldescent أو dyshormonogenesis. ممكن يكون برضو سببه iodine deficiency اللي هو endemic goiter أو antenatal maternal intake of antithyroid drugs like thiouracil or radioactive iodine. فدي أسباب congenital hypothyroidism. acquired hypothyroidism اللي هو Hashimoto thyroiditis, which is an autoimmune disease of the thyroid gland. وممكن يبقى associated with other autoimmune disorders زي type 1 diabetes. ده causes of hypothyroidism. في النيوبورن ممكن يبقى no goiter أو goiter، وفي childhood ممكن يبقى في no goiter أو goiter. وأسبابه ففي النيوبورن no goiter, thyroid gland dysgenesis or ectopic location. لو في goiter ممكن ده يكون ايه؟ dyshormonogenesis اللي هو inborn defect in hormone synthesis or effect. يعني في مشكلة في السينثيسيس of the hormone، فالغدة بتقعد تكبر تعمل goiter ومش قادرة تكون الهرمون. في الchildhood الجويتر أشهر سبب اللي هو إيه؟ هاشيموتو ثايرويدايتس. طبعا زي ما قلنا دلوقتي في النيوناتال ثايرويد سكريننج اللي هو implemented in Egypt for all newborns to prevent mental retardation. يعني hypothyroidism is a preventable cause of mental retardation. لو شخصناه بدري وخد العلاج بدري, this can prevent the occurrence of mental retardation in these children. So it is usually done between the 3rd and 7th day of life. A blood drop is obtained by heel prick on filter paper and analyzed for TSH. If the TSH level is more than 20 milliunit per liter, an immediate blood sample is withdrawn and analyzed. If data are confirmed, treatment is immediately initiated. فبناخد العينة اهو من كعب الرجل وده برضو congenital hypothyroidism occurs in 1 to 2,000 to 1 to 4,000 live births. Most congenital cases are sporadic, but 10 to 20% are inherited. قلنا causes either dysgenesis, which is the most common cause of congenital hypothyroidism. The most common form of thyroid dysgenesis is an ectopic gland. أو dyshormonogenesis, which is abnormal thyroid hormone production, and it can be due to defect in any of the steps of thyroid hormone biosynthesis. زي ما قلنا إن congenital hypothyroidism ممكن يكون نتيجة لmaternal iodine deficiency أو نتيجة لtransplacental transfer of antibodies or goitrogens أو ممكن يكون سببه central hypothyroidism اللي هو secondary والtertiary causes اللي هو زي ما قلنا نتيجة ل hypothalamic or pituitary causes. وفي الحالات دي ممكن يبقى في other pituitary hormone deficiency. So the patient with congenital hypothyroidism which is not treated ممكن يبان لنا ب protruding tongue, growth retardation, ممكن يبقى عنده jaundice, dry skin, slow reflexes, hoarse voice. فالطفل ده عنده protruding tongue, عنده umbilical hernia, عنده periorbital edema, عنده depressed nasal bridge, دي برضو بعض الصور ل congenital hypothyroidism. Coarse facial features, this baby has a goiter, coarse facial features, protruding tongue, umbilical hernia. This is a baby before treatment and after treatment. Alert looking, هنا dull looking face. زي ما قلنا في delayed bone age، تمام؟ فهنا في absent distal femoral epiphysis. This is evidence for the onset of hypothyroid state during fetal life. So these children may be asymptomatic at birth due to the transplacental passage of moderate amounts of maternal T4. بيبقى عندهم prolongation of physiological jaundice due to delayed maturation of glucuronide conjugation. بيبقى عندهم coarse and dry skin. بيبقى عندهم coarse facial features, increased head size. ممكن ال posterior fontanelle يبقى also opened. يعني دايما بيبقى ال anterior fontanelle محسوس، ممكن ال posterior fontanelle برضو يبقى محسوس. بيبقى فيه large tongue, choking during nursing أثناء الرضاعة. ممكن يبقى عنده yellowish tinge of the skin due to carotenemia. ممكن الطفل ده يبقى عنده constipation. بيبقى فيه hairline reaches far down on the forehead. بيبقى عنده umbilical hernia و large abdomen. واضح هنا coarse features, umbilical hernia. And this is a thyroid scan showing the normal uptake وده normal site و normal uptake وده normal site و increased uptake وده normal site و decreased uptake وهنا مفيش uptake خالص وهنا في ectopic lingual uptake فوق هنا تحت اللسان أو عند اللسان lingual uptake. ده ectopic goiter. لو اتكلمنا بقى على acquired hypothyroidism اللي هو الهاشيموتو thyroiditis أو autoimmune أو lymphocytic thyroiditis. It is a common cause of goiter and acquired thyroid disease. It occurs during later childhood and adolescence. In 25 to 35% of patients بيبقى فيه family history of thyroid disease. احنا اتكلمنا في الأول خالص على الجريفز disease اللي هو برضو autoimmune بس بيسبب hyperthyroidism. Hashimoto thyroiditis is also an autoimmune disease. يبقى Hashimoto thyroiditis is an autoimmune process targeted against the thyroid gland with lymphocytic infiltration and lymphoid follicle and germinal center formation preceding fibrosis and atrophy. عشان كده ساعات بيبتدي بهايبرثايرويدزم أو euthyroid وبعد كده eventually بيبقى في hypothyroidism. Clinical manifestation include a firm non-tender euthyroid, hypothyroid or rarely hyperthyroid. في هذه الحالة بتسمى hashitoxicosis. Diffuse goiter with a pebble-like surface. Onset typically occurs after 6 years of age with a peak incidence in adolescence and a female predominance. يعني برضو في female الفيميل أكتر من الميل. Hashimoto thyroiditis برضو ممكن يبقى associated with autoimmune diseases زي celiac disease و type 1 diabetes mellitus و adrenal insufficiency and hypothyroidism. وممكن يبقى associated with trisomy 21 اللي هو Down syndrome and Turner syndrome. They are more predisposed to development of autoimmune thyroiditis. في حاجة اسمها autoimmune polyglandular syndrome type 1 و autoimmune polyglandular syndrome type 2 ممكن يبقوا associated with hypothyroidism. فبنشخص ازاي؟ بنلاقي elevated TSH و low T4 و free T4 وبنعمل thyroid antibody titers to thyroid peroxidase and thyroglobulin بنلاقيها positive. Thyroid ultrasonography is not necessary to establish the diagnosis of autoimmune thyroiditis and should be restricted to children with thyroid gland asymmetry or palpable thyroid nodule. في حالات عايزين نفرق ما بين الهاشي توكسيكوزز والجريفز ديزيز ممكن نعمل ثايرويد سكان بيبين لنا reduced uptake. ف دي صورة بتبين إن ال TSH عالي وال T3 وال T4 واطيين وبيبقى فيه anti thyroid peroxidase و anti thyroglobulin antibodies. بتيجي الكلينيكال بيكتشر بتبريزنت بايه؟ عكس بقى ايه الثايروتوكسيكوزز. بيبقى فيه cold intolerance، بيبقى فيه constipation، بيبقى فيه weight gain despite ان الواحد مش بياكل كتير، بيبقى فيه fatigue، بيبقى فيه depression، ممكن يبقى فيه menstrual irregularities برضه. acquired hypothyroidism ممكن يكون نتيجة برضو غير الهاشيموتو لأيودين deficiency، وده most common worldwide cause of hypothyroidism in children. في حالات الأطفال اللي بيبقى عندهم restricted diet نتيجة multiple food allergies وبرضو في بعض أماكن من العالم اللي موجود فيها iodine deficiency. ممكن الايودين ممكن الاكوايرد hypothyroidism يكون سببه برضو radiation therapy to the head and neck in certain cancers و secondary to certain drugs such as amiodarone. وممكن يكون سببه surgery done in case before يعني for Graves' disease, for thyrotoxicosis or thyroid cancer يعني after thyroidectomy. فده symptoms with signs of hypothyroidism. زي ما قلنا بيبقى فيه بقى هنا bradycardia، بيبقى فيه cold extremities و cold intolerance، بيبقى فيه delayed bone age. زي ما انتوا خدتوا قبل كده ان احنا بنعمل الثايرويد بروفايل for children اللي عندهم short stature، فبنلاقي عندهم delayed bone age. ممكن يبقى فيه weight gain، ممكن يبقى فيه hypercholesterolemia، الحالات دي ممكن يبقى عندهم hyperprolactinemia، البرولاكتين level بيبقى عالي. precocious puberty in severe cases. فبنفكر في حالات الهايبوثايرويدزم، في حالات الايه الشورت ستيتشر، ودي بعض الايه السيمبتومز والساينز of hypothyroidism. فالدايجنوزز بيبقى روتين نيوبورن سكريننج زي ما قلنا والثايرويد فانكشن تيست، وسامتايمز بنعمل ثايرويد التراسونوجرافي وراديو نيوكليوتايد سكان. routine newborn screening detects hypothyroidism before clinical signs are evident. ولو زي ما قلنا if we find it positive اللي هي TSH عالي، بنعيد تاني التحاليل للتأكد ونعمل free serum thyroxine و thyroid stimulating hormone. Free T4 is better measure of thyroid function than total T4 علشان patients علشان ال T4 بيبقى affected بال thyroid binding proteins اللي هو ال thyroid binding globulin والترانستيريتين والالبومين. في حاجة اسمها reverse T3 measures the metabolically inactive form of T3 وده بيبقى موجود في periods of illness or starvation ومش بنستخدمه في ال measurement of hypothyroidism. ايه التريتمنت بقى؟ thyroid replacement. In most treated infants, motor and intellectual development is normal. فبندي ايه؟ بندي L-troxin أو L-thyroxine 10 to 15 microgram per kg orally once a day. With this dosage is intended to rapidly في خلال أسبوعين bring the serum T4 level into the upper half of normal range for age. We reduce a TSH within 4 weeks. يبقى أول ما بنشخص congenital hypothyroidism بندي treatment as soon as possible أو immediately 10 to 15 microgram per kg orally once per day. وبنمونيتور إن إحنا نخلي النسبة بتاعت ال T4 في ال normal range, upper half of the normal range. Goiter with normal TSH usually is not an indication for treatment. So, some key points. Hypothyroidism in infants is usually congenital. Acquired causes become more common with age. Most congenital causes involve dysgenesis of the gland, but genetic disorders affecting thyroid hormone synthesis may occur. Most hypothyroid infants are detected through routine newborn screening. Confirmed diagnosis with free serum thyroxine and thyroid stimulating hormone. If confirmed, do imaging tests to detect structural thyroid disorders. Treat with L-thyroxine, adjusting the dose to maintain T4 and TSH levels within the normal range for age. Central hypothyroidism اللي هو secondary with tertiary manifests with a pattern of low free T4 and non-elevated TSH. Children confirmed to have central hypothyroidism should have MRI of the brain and pituitary to rule out central nervous system lesions. Although not a hypothyroid condition, في حاجة اسمها congenital thyroxine binding globulin deficiency وده بيحصل in 1 in 10,000 live births It is associated with a low serum total T4 concentration, normal TSH, and normal serum free T4. It is euthyroid, يعني thyroid function أو الفري T4 بيبقى normal، يعني أو الثايرويد function بيبقى normal. This is an euthyroid condition and does not require treatment with thyroid hormone because it is merely a binding protein abnormality. It is commonly X-linked dominant. Graves' disease is the commonest cause of hyperthyroidism in children and adolescents. Treatment includes anti-thyroid medication, carbimazole, radioactive iodine, or surgery. Attention should be paid to other associated autoimmune conditions such as type 1 diabetes mellitus. Don't forget thyroid screening for the newborns. And this is a table showing what does it mean if my thyroid levels are abnormal. Pendred syndrome is goiter and congenital deafness, often euthyroid, but may be hypothyroid. These are the references. Thank you.